There are several publications that have actually found bacteria in the meconium, which would suggest that obviously there is a microbiome in utero. They're looking at it in the placenta. They're looking at it, in the umbilical cord. So we have some meconium from a species that we've been looking at, and we found bacteria in meconium as well.
It's kind of like, when does life begin? When does the microbiome begin? Yeah, very interesting.
Sorry for saying sorry. Media presents the Purr Podcast, the best podcast for feline medicine and surgery with tips, tricks, and updates for the entire veterinary healthcare team. If you're dying to know more about cats, keep on listening. Here are your hosts, Dr. Susan Little, famous cat vet and textbook author, and Dr. Jolle Kirpensteijn, talented surgeon and social media geek.
Hi, I'm Dr. Susan Little.
And this is Dr. Jolle Kirpensteijn with the Purr Podcast. And this is the second episode of talking about the cat microbiome.
Yeah, with Dr. Carolyn Mansfield. Thank you so much for being with us again. There's so much to talk about.
Thank you. You're welcome.
It is a field that is developing rapidly.
It is indeed. It's exciting to be part of it.
Viral, although it's bacteria that we're talking about.
I do viral work as well. I could, yeah.
There you go. We can say it's gone viral. It's okay.
Excellent.
I like that.
So thanks for being here again.
My pleasure.
I think one of the things that really has changed in the last couple of years is that they're not only looking at what species are in the microbiome and what is the change in the species, because there was a lot of discussion what's the use of it, but they also look at what are the species producing, and and so it's the whole
it's an ecosystem
within the microbiome that they're focusing on now, and some really interesting stuff is coming out, because obviously all the products that they're producing they're taken up by the gut too. So that's like you said, serotonin is one of the ones, but it's probably a whole ecosystem of balances, checks and balances that are going on there.
So there's probably a degree of redundancy within the microbiome. So if one particular species of bacteria goes up, or goes down, there might be some other bacteria that take over their function. So just because you see that dysbiosis doesn't necessarily mean that there's a functional dysbiosis.
Yeah.
So it's really important that that we look at what's the metabolic response to that, and even looking at metagenomics. So what are the genes that those bacteria are encoding doesn't necessarily help us, because the genes can be expressed, but if they're not actually producing the proteins or the metabolites,
that makes sense.
It also doesn't help tell us. The other issue with a lot of the the next gen, like the pyrosequencing and the large output of data, is you get so much data, and it's predominantly Bacteroides or Firmicutes, and so you have these massive or Clostridia, you get huge sequences from those bacteria, but they actually functionally might not be particularly important. You're actually missing the functionally important ones that are down here. The other issue is if you're looking at fecal bacteria, they might not actually be the bacteria that are interacting with the immune system. They're just the bacteria that are in the feces. Okay, so we're kind of limited ethically in how we can assess the bacteria that are interacting with the immune system, because the only way to get that is either endoscopically with biopsies or with brush samples from the intestine, which requires an anesthetic.
It's invasive.
But I mean, can they do that in lower species where they have a microbiome too, because if you look at Drosophila, I mean, we know everything about that fruit fly, and so can they probably have a digestive system too, and they probably have a microbiome in it too.
So they've it's done extensively in rodent models, but it's not the same microbiome.
Well,
no, that's true. That's true. But I mean, I think
everything else is controlled. So genetically, they're the same. Environmentally, they're the same. So we're just looking at one factor, and I guess, it can. I think it's the first step. But if we actually want to say, well, what's the translational impact of that, or what does that actually mean? We actually need to get samples, and no one's going to consent to having their baby scoped,
No,
at 2 months of age.
Although what I thought was really interesting is, the new endoscopic pill that you can swallow, and that they are developing into being able to take some samples while it goes down the gut.
Yeah.
I mean, there might be some minimal invasive techniques that you can use.
Yeah, and so one of the collaborators that we're trying to work with at Melbourne, where this might be hopefully not too many people listen to this and steal our idea for the next research project.
Be a little vague.
Has developed a capsule that actually will measure short chain fatty acids as it goes through the intestinal tract, which is, for us, that's one of the biggest challenges, because measuring short chain fatty acids in feces is actually very challenging because they're volatile, and so it doesn't help.
That's awesome. That makes a lot of sense. I mean, for me, that we were when I was still doing my oncology stint, we were thinking about, if you can take something that can take biopsies from your gut.
You'd almost want it to be like a video game, though.
Yeah.
Because you want to be controlling,
you want a remote control.
I want that one there.
Right.
Otherwise, it could just be a random spot.
Yeah.
Which
I
guess
is
is
true.
okay.
I mean, but you have diseases that affect the whole gut, and so instead of if you can take if it's kind of a brush and it brushes the site and you get samples that way. I'm not sure. I mean, it's I think there will be so much more development. And
so the other thing that we're doing, which we're about to submit the paper for publication, is we've actually isolated the bacteria that are coated with IgA and IgG in feces. So these are by default, I guess, the bacteria that are closely interacting with the intestinal immune system. So not the ones that are sitting in the mucus, but the ones that are coated with IgA or IgG are actually interacting directly with the immune system.
Yeah, it makes so much sense. It makes so much sense. And then you cannot, because if you think about it, this is a huge organ we're talking about. It's not like a small organ. It's quite a big space, and also if you look at the surface, the contact surface of this organ, it's just unbelievable. We always think about the skin as being a contact surface, but the skin is kind of a protective surface. This is a surface that's supposed to receive and give, and so it makes so much sense to do that. Yeah, so it's really cool. I think this is I can imagine that you're very enthusiastic, because if I was a GI, internal medicine person, this is where you'd want to be. This is the era, where everything is going to happen.
I hope so.
And so, because and then be part of that. I mean, I can see that, because for me, the whole 2 days was an eye opener. I'm a surgeon, and I did a lot of GI surgery. And so I know a little bit about it, but it was an eye opener because of the potential that's there, which is so cool. And then we talked about the gut renal axis and the gut brain axis and the gut this axis, and it's all connected, and it's logical because we're one whole ecosystem once again. And I think that is super. I mean, it's very exciting stuff. Funny thing of that meeting once again is that there were some human MDs that were talking about it, and Curtis was the first one that was talking about the new technology that they use to look at the microbiome, which is flabbergasting. But someone said the biggest discussion that they have right now is, when does the microbiome start in a newborn?
Yep.
And he said that's where if you're in an MD microbiome, that's where the fiery discussions start, because people are disagreeing so.
Yep, there are several publications that have actually found bacteria in the meconium, which would suggest that obviously there is a microbiome in utero. They're looking at it in the placenta. They're looking at it, in the umbilical cord. So we have some meconium from a species that we've been looking at, and we found bacteria in meconium as well.
It's kind of like, when does life begin? When does the microbiome begin? Yeah, very interesting. I want to ask you, talking about microbiome, how does that intersect with some common feline GI diseases? So inflammatory bowel disease, right? Which, so I have 2 feline only clinics in Ottawa, and my partner in the clinics used to say to me, we do a lot of GI endoscopy on patients, and he said, you find IBD in everybody. And I'm like, well, there's a lot of IBD, right? And it's amazing to me, that there just is so much. And so what's the connection? right? How does this interact? And I know you don't have the answer, but let's just talk around like, what are we learning about this, right?
So I probably should have read this paper a little bit more recently because I don't have the exact figures to hand, but there was a paper that came, I think it was Sina Marcilla. She did a paper where she did scopes of cats that were undergoing dentistry, dental. Yeah. Do you remember that?
Yes, I know what you're talking about, and they were scoped at the same time, but they weren't GI cases.
They weren't GI cases, so they were older cats that were considered to be normal by the owners. Yeah. What's normal? That's another whole conversation. But we're considered to be, GI normal.
Say clinically normal. Yeah.
Yeah, and a surprising number of them, I would say, I think might have been up to 2/3 actually had GI pathology on those biopsies, and a few of them actually were diagnosed with lymphoma.
Isn't this amazing?
Small cell lymphoma. And not all of them in the follow-up period of that publication went on to develop GI signs, but a couple of them did. Yeah. So there's two ways to interpret that paper. One is the histology means nothing. And that's a spectrum of normal for all cats.
Yeah, that's true. What is normal, right?
Yeah. And so what we're saying is lymphocytic plasmacytic inflammation is just the gut reacting to normal stuff. Yeah. Maybe it reacts to the presence of the scope. Maybe, who or the fasting.
Yeah, who knows?
Who knows? So maybe it's not really inflammation, and that's just an age-related change. Mm-hmm.
So, has anybody looked at that?
No.
Look at an age spectrum, right? So you could hypothesize that, right? That you might see more lymphocytic plasmacytic change in like a 10-year-old cat than a 2-year-old.
Absolutely. I think that's what happens with pancreas. I think what's diagnosed
there you go.
as
There's
feline
another
pancreas.
one.
I don't believe what's diagnosed.
There's another one. Yeah.
I think the pancreas is probably just normal.
Yeah.
And it's diagnosed as pancreatitis.
And we don't have like life stage normals.
No. Well, they say there's pancreatitis in 60% of cats, and I go, well,
I know. I remember that paper. It's like, I don't think they have pancreatitis, right?
No, I think they have lymphocytes and plasma cells in their pancreas, which is a completely different thing. Yeah. So the first question is that a normal spectrum, in which case we're over-diagnosing IBD in all of these poor little cats. However, they are vomiting, and we're not doing it for no reason. Right. Or a lot of these cats do actually have subclinical intestinal disease, and we're missing it.
Yeah. I know, it's kind of scary both ways.
It's very scary both
ways.
When
you think of that, right? It's kind of scary both ways, yeah.
And what role does the microbiome? I don't know.
Yeah, there you go. Yeah, so I think that's a big, hopefully to be explored area. So what are the microbiome disruptions in these guys? Is there... Oh, well, we already know there's a change in your microbiome with your age anyway, right?
Not so much age. Not so much age. Not until they're very old.
Ah, okay.
So the microbiome's pretty. It's unstable until about 3 to in domestic animals. Yeah. It's pretty unstable until about 3 to 4 months of age.
Right.
And then it's relatively stable, barring illness.
Yes.
Up until about 11 to 12.
Yeah. Okay, so once we're in senior.
Once we're senior,
or other species years. Yeah. Okay. Then it can change.
And I can imagine that's also the reason why antibiotics have such a big effect, because you have such a stable microbiome until you start popping in things that disrupt it completely.
Yes, but again, that disruption is going to be maximal in that initial period when the microbiome is first being established. If you've got a healthy and the problem with antibiotics is the effect is quite asymmetrical, and it's quite variable and dependent on the individual. So some individuals will return to normal and some won't. And it's hard to predict which ones will or won't in terms of that. As long as the diet remains relatively consistent, the microbiome will stay pretty consistent. I would love to do a study on the microbiome of cats with renal failure.
Why?
Because I think we could actually use it to detect changes before they get over. Before
SDMA?
Yeah,
or
before.
Even then? Yeah, that's...
SDMA.
Oh.
Yep, I do.
Interesting. Yeah.
But, how that could happen clinically, because at the moment, that's not something that's even feasible. But I think it would be fascinating to track cats and see whether we can identify microbiome changes through markers.
But with your magic pill, you can change
the magic pill.
The fatty acids will change then too, so you might pick them up much earlier.
I think we're maybe 10 or 15 years away from something like that. It's
agree.
probably not a magic pill, but maybe it's you send your poo sample off every year and to get it checked.
Because we're talking about an ecosystem, I think that just focusing on the GI microbiome, I think there will be, if your GI microbiome changes, there probably will be reflections in your derm microbiome and the rest of the microbiome. So I'm not totally sure if the internal GI microbiome is the only way you should go. I think you need to look at it holistically again. So if it's true that the kidney will affect your GI microbiome, tell me that it will not affect your inner ear microbiome or whatever.
Might affect your oral microbiome. I'm not so convinced about the derm.
How so?
Because there are no...
You don't like derm?
No, I don't like derm. I don't think there are any studies in people that have actually shown that there's a connection between the two.
Really?
Yeah.
I'm posing that right now because I just...
but I think it's harder. I think it's probably harder in people because of washing.
Yeah, true.
Probably potentially in cats, maybe because of grooming.
True.
Maybe.
Yeah, we're not great at licking ourselves, but cats
but
follow their derm
we
microbiome
use
all the
a lot
time, right?
We use a lot of products, and obviously that will affect your.
Yeah.
But with animals, it's a lot less likely.
Yeah.
So that might be
Especially
an
cats.
easier reflection.
Yep.
And it's interesting because I went to a derm meeting due to what I'm doing now, and they're talking about the microbiome too.
Yeah, of course.
It's just everybody is talking about the microbiome, and I
mean, it's really important, but I'm not sure about the connection yet.
Yeah.
So I think everything is connected. So that's my
circling back to GI. A lot of this is really challenging our treatment paradigms, isn't it? Because traditionally, when we've got cats with either acute or chronic GI disease, what are the things you think about? What's written in textbooks? It's like try metronidazole, try tylosin, try a diet change. And now we're like, those things kind of disrupt the microbiome, right? So like how do we fit that
How
into?
do I do?
Yeah.
So for me, I want to make sure that there's no liver involvement, that there's no concurrent cholangitis or cholecystitis. So with acute vomiting plus or minus diarrhea, and if the animal, if the cat's like a sick cat, I'll probably they're probably not the cats that I scope, but they're the cats that I look at their liver a little closely, and I'll aspirate their bile and I'll put a feeding tube in. They're the cats that I'll actually give antibiotics to, and I probably would give amoxicillin rather than metronidazole, because it's excreted in the bile. I don't know if you agree or disagree with that.
Absolutely.
So for those, I think that's kind of slightly different, and I think you're actually treating the liver disease rather than the intestinal disease, and then I kind of wait and see what happens.
Right.
I probably then would treat it with a diet after I've treated the acute liver
issues
flare up.
Yeah.
And most of them probably don't need anything other than that. For the chronic ones, I'll start with
chronic enteropathies.
I'll start with diet, and then I have this debate with our feline medicines. I had this, not debate, we had a conversation. Debate's a very, very strong word. We had this conversation. And so we were talking about, they asked me, do you scope your cats?
This is a bit of a loaded question, right?
Yeah, and I was like going, where are you going with this? I know why you're asking me.
Yeah.
And they said, what does it matter if it's small cell lymphoma or
so
if it's
IBD? This has been the same question.
We had this discussion.
It's a reasonable question.
It's quite a reasonable question. And I said, I often I have that conversation with the clients and I talk them through it because often it's the same thing. You try if the cat's chronic and not doing too badly,
you've got time to play.
You've got time to play, and cobalamin and diet and see what happens, and then but then do you give pred, and do you feel comfortable giving chlorambucil if you don't have a histological diagnosis? Part of me feels a bit icky doing that. And then I think back to all of the scopes, how many times have I ever got an unexpected answer? How many times have I ever got something that's not lymphoma or not IBD that I haven't seen on ultrasound? You haven't got a clue that something's a bit funky.
And in a cat, that's probably pretty rare.
Yeah, it's really rare.
Yeah.
And we have a wide range of listeners, so how do you do that conversation with the clients?
So how do we do it? So I guess I sort of talk about the fact, and the other thing is, even when I do an endoscopy, so I pretty much just say, so inflammatory bowel disease is a chronic inflammation. We don't know what causes it or what triggers it. What we hope is that by changing the diet and changing the stuff that we're putting in the gut, we can dampen down the inflammatory response. Mm-hmm. So that's the best outcome for your cat, because there's no more drugs, testing, no drugs, nothing else that's required. And that's fine if the cat is eating. Yeah. If the cat's not eating, that's a different conversation. Yeah. But if the cat is eating, then we'll say, let's try that. And if it works, it actually really doesn't matter what the disease is. To be honest.
This is true. This is true. I mean, because you're looking for an outcome, and if you get the outcome.
Yeah. And the majority of cats that have a diet response have a permanent or at least a long-term diet response.
And they have it reasonably quickly, usually, too.
You're not
within
usually
1 to 2
weeks
and weeks.
And so I say all that to them, and I say, and 50% of those cats, if you actually want to re-challenge them back to their original diet within 6 to 12 months, 50% of them can go back to their original diet. Most owners will go, I'm good.
No. I don't why bother? Why take the chance?
I don't want to go back to that. So that's the original conversation I have. Now, if that doesn't work, well, then I say, so we're looking at inflammation, or we're looking at lymphoma. Yeah. So lymphoma is a cancer, but we're not looking at bad cancer. Okay, so we're looking at a fairly benign, a fairly small cell lymphoma. And it's actually quite hard to tell the difference between the two.
Can be.
Clinically, they look the same. Sometimes they look the same on scope. Yep. Sometimes they
histologically.
Sometimes they look the same on biopsy.
Yep.
And sometimes I might not biopsy the right spot.
Absolutely. It's not always diffuse disease.
And I could tell you that it's got IBD, but in fact it could have lymphoma.
There are cats, I think, that have
both IBD at one end and lymphoma at the other, and or even if I'm in the right spot, part of the gut, I could still miss the bit. There is a lot of testing that we can do in addition that will help increase our diagnostic sensitivity. In the long run, the survival time for IBD and lymphoma is very similar. Yeah. And the treatment is very similar. Yeah. However, knowing what you're dealing with can sometimes make it a lot easier
and quicker to
get to that point. Right. So if I'm dealing with lymphoma, I'm not going to mess around with a pred trial. I'm going straight to chlorambucil. Yep. If I'm dealing with IBD, I'll take a little bit longer to get there. Because I don't want to go straight there. So, and if the cat's not eating, and I haven't got the time for that diet trial, I'll be talking about putting a feeding tube in. Yeah. And if I'm putting a feeding tube in, I'm giving them an anesthetic.
Yeah.
And
so why not?
So why not?
Yeah. Yeah. I think that's a very reasonable way to approach. There's no one size fits all, right? No. It's what works for the cat. It's what works for the owner. It's what the owner can do, what the owner can afford, what else the cat needs. I don't know that there's a right or a wrong way to this.
I no longer recommend XLAP.
Yeah.
I think sometimes that's a step too far.
We do sometimes do it for cats where we've ultrasounded them and we've seen multiple abnormalities.
Correct.
So we want pieces of multiple organs.
But they're not the ones I'm thinking about. They're not the
they're not the straight. Exactly.
Yeah. So they've all had. Sorry, I just. They're not the ones that I'm talking about doing endoscopy on. So I've always ultrasounded them before I've gone to that extra diagnostic step, because that will hopefully give me a clue as to whether endoscopy is even likely to give me something. Anyway.
And just from a surgeon's perspective, I hated XLABs for just biopsies. I mean, it's so maximally invasive.
Yeah, but you're a minimally invasive
and
person,
so for me,
right?
It just never made sense. And then they said, okay, just take biopsies of everything because you're in there anyway. And I'm like, it doesn't make any sense. Yeah, there must be a better way to do this. And then, take liver, pancreas, and then anywhere in the body. It's just like crazy. It's what are we doing?
Yeah, and the cats are often debilitated by that stage, and they get cold, and it's a big deal. And the owners often don't want that. And by the time they come to me as a referral, they've been through a lot, and they just. Often the cats are a bit older. They really, really don't want that.
Yeah. Well, that's the art of veterinary medicine, though, right? It's trying to tailor what's correct for that, or what's best for that cat and that owner.
I know we have a little bit of a time issue, so it has been.
Are we running out of time already?
Yeah, but we're already done 50 minutes, so we're doing really well. But I know you're
You're in demand today. You've got things to do.
Very popular.
Busy
So
lady.
I really appreciate you being here and talking to us. And like I said, I'm really excited about this time
fascinating
period.
discussion. It really is.
Super exciting.
And it's really changing our paradigms.
Yes.
Isn't it?
Yeah.
And it's uncomfortable to have your paradigms changed, right?
Yeah.
But you got to go with the flow.
But you better be in the change than
better be in the change.
So,
Correct.
So that's exactly it.
Correct.
There you go.
So thank you so much.
No problem at all. It was a pleasure. It was surprisingly painless.
Good.
Great.
I promised you it would be. We promised you it would be. We're pretty easy people.
All right.
So thank you.
No worries.
Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat, Clinical Medicine and Management, and August, Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs, and you can follow her on social media with the handle @CatVetSusan. Dr. Jolle Kirpenstein is a diplomate of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Jolle works currently at Hill's Pet Nutrition. You can follow him on social media with the handle @GVETSX. The opinions of this podcast are those by Dr. Susan Little and Dr. Jolle Kirpenstein. Veterinary medicine is a complex profession, and often there are multiple diagnostic and therapeutic options for different disease processes. If you're a pet owner with questions, please go to your local veterinarian. If you're a veterinary professional, ask your questions on our Instagram page @Purr Podcast.